Hi, everyone. Welcome to our ST125 Unit 1 discussion here on Tuesday, our first quarter, our first week of the quarter. My name is Megan Ludwig. A little bit about me so you can put a face to the name. I know with some of these online classes, it seems like nobody's really there behind the screen, but I promise there is somebody here. So this is me. I graduated in 2008 with my Surg Tech certificate. Back then, we only had to have a certificate. And then I practiced for about 4 years at our local hospital. I was on the ENT and eye team. That was my specialty, but by noon, all of our doctors were done. So I got to do a lot of other things. So I scrubbed pretty much any type of case that we had. So I started teaching in 2012 at our local career center. And actually have been teaching part-time and now full-time since 2012. So I'm going on my almost 12 years of teaching, which is hard to believe. I went back and got my associates, and then I decided to go ahead and go to my bachelor's, and I'm in the process of maybe starting my master's. So I like to learn. Hopefully, you guys do too, because in this profession, you really do have to enjoy learning because the world of surgery, sterile processing, it is constantly changing, evolving, and updating. So you have to stay on top of those things. So this is me teaching in our lab. And then these are my two kids. I have two kids and two dogs, so I stay pretty busy. All right, so every week I like to give you a little update on your assignments. I know you can pull that up on your syllabus, but just to remind you of what you've got going on. Um, a lot of things I think I see the most with my students is with the discussion that they forget to go back and respond to a peer. Yes, it's just a few points here and there, but those can add up if you don't do that every week, which could really eventually lower your grade, from an A to a B, B to a C, whatever it is. So go back, make sure you respond to at least a peer for full credit, by Sunday, preferably. Okay. So that's what you've got going on this week. And so our objectives for Unit 1 are really to just kind of start discussing basic instruments. We're going to categorize them and then identify basically what they're made of and kind of go from there. So this class should be pretty fun. A lot of people really enjoy this aspect of the job, learning new instruments. It can seem overwhelming. So I pose this question first. How am I ever going to learn all these different instruments? It is daunting. So if you've cracked open your textbook or those flashcards that you've gotten for your instruments, it's a lot. Now, just keep in mind that even me, after however many years I've been doing this since 2008, there are still instruments I see that I'm like, I don't know what that is. I've never seen that in my life. So you're going to have those days where you're working in surgery and you don't know what it is. But the goal is to be able to at least look at it and categorize it and have a basic idea of what it does. If you can look at the end of it and realize, okay, this might be good to clamp really dense tissue as opposed to delicate tissue, it kind of at least will clue you in as to what the surgeon may need or what he or she may need it for. So that's really the goal. You know, you could memorize all the instruments, maybe, but nobody does. Okay. And if you do, you may, let's say, travel and you go to another part of the country. That surgeon might call the Rochester peen clamp a Kelly clamp. Okay. A lot of surgeons call things different names. So I always try to point those out to my students, and I'll do that for you. It could be a geographical thing, but we'll work on some of those as well. But I like this meme because it's pretty accurate when you can find that thing the surgeon wants, or you know what they want, even without them saying it, just because you know what it looks like. It's pretty fun. All right, so what are instruments made of? We do have a couple different grades of instrument material. The ones that we use in surgery have to be stainless steel surgical grade because that stainless steel is harder than a floor or disposable grade. If you were to use a floor or disposable grade stainless steel, it would bend pretty easily. It could crack, it could scratch, which would harbor bacteria. So you don't want that. You have to have that surgical stainless steel. Now, sometimes there's a little bit of other metals mixed in, like chromium or nickel, but typically it's stainless steel. And that was a Babcock clamp, by the way. Just go back and try to keep up with these. This is a Babcock clamp. So it is used to clamp tubular structures. I got that circle there, so that kind of clues you in there. Okay. So what are instrument finishes? What are they made? We know what they're made of, but how are they finished? So yes, it could be stainless steel, but there could be a coating on the outside for different reasons. So let's start at this top, my left corner here. So this is the most common, this polished look. Most surgical instruments for, a good majority of the cases will have a polished finish. This is the end of a Richardson retractor, just your typical medium, small depth retractor. Okay, and over here at the top is a black chromium finish. They are coated in usually a matte black. So they're really good for, maybe you're in a laser case, a case that's using a laser to maybe break up a stone or something, whatever the reason. You don't want a laser beam to reflect off of any instrument. Like if it were really polished, that laser could easily reflect and bounce off and could, potentially blind somebody or catch on fire. So you want to eliminate that potential if you're using lasers, or just maybe the surgeon, is sensitive to glare, right? These do provide a bit of a glare. So these are non-glare. All right, bottom corner, we have these titanium anodizing. So it is kind of coated in this, and it makes it look colored. It's really kind of bizarre. So usually they're blue, but they can be all these different colors. So what it does is it provides a harder surface for those types of things. And so that's why they're really good for things like orthopedics or implants, because they are a little more durable. Then we have in the middle these gold dipped instruments. These could be scissors, needle drivers. This is a type of hysterectomy clamp. We call it a Z clamp. Some people call it a Zephyr clamp, hysterectomy clamp. So if they're gold tipped here, it indicates that in the tip of the instrument, there are tungsten carbide inserts, which makes it very dense and really hard to like make a mark in it. It's just going to last a lot longer. They are more expensive, but the tips of those will last a lot longer because they're more durable. And then here at the other bottom right corner, we have a satin finish. This is called a Farrier ear speculum, used to see inside the ear canal. So it is a little bit less shiny than our polished, but a nice satin finish. So that's pretty common as well. All right, so here are our categories of instruments. I know it seems like a lot, but I wanted to at least show you what these categories are, what you're looking at, and give you a couple examples in each of those. Yes, there's obviously thousands more in each, but I just wanted to touch the surface here, and we'll build on this every week. So first main category of instruments are cutting and dissecting. So the picture here at the top are your Mayo scissors. These are very common everyday use scissors. I mean, they're in most general surgery cases. I started with some of the more basic general items that you would see most often. So Mayo scissors are good for cutting dense or heavy tissue. So this is where kind of anatomy comes in and why you do need to know some anatomy. If you're going to work in surgery, you need to be able to identify what the surgeon is working on. So when we say dense or heavy tissue, it could be something like fascia, which is a really dense covering over like muscle. Muscle is dense, tendons, those are dense tissue. All right, knife handles fall in this category as well. You would attach some sort of blade to it. We'll talk about the way knife handles and blades, work together later. They do match up a certain way. Then you have clamps, or clamping or occluding is another word you could say for that, clamping and occluding categories. So we may need to occlude or close off a blood vessel, or to clamp a bleeder, sometimes what we call it. So clamping, one of the most common instruments ever used in surgery, is the hemostat. Sometimes we call it a stat or a snap or a tag. There's a couple other names for them, but those are the most common ones for hemostat. It's kind of hard to tell the size in this picture because there are a few in this category that look very similar. You have hemostat, mosquito, Rochester peen, cryo, tonsil schnitt. They all look the same unless you see them lined up next to each other. It's hard to tell just from this picture. In this category, you also have the Haney hysterectomy clamp. It looks very similar to that gold uh, ringed instrument I showed you before that we call a Z-clamp. All right, retracting. This category is very important because if the surgeon cannot see what they are doing, the surgery is pointless, right? They have to be able to see. So retractors are super important. So this one here kind of just got a big curve to it. The handle end that you would hold is the smaller little angle here, but the big curve is what would do the retracting, and that is a Deaver retractor. These come in different widths. That's kind of hard to tell from the picture, but that's probably about a 2-inch wide Deaver. Some are 1 inch, some are 3 inches, just depends on the need. So they're good for retracting in deep abdominal incisions, so Deaver retractor. And then Richardson retractor, I showed you, I think it was on the previous page, but those can come in a variety of widths as well and depths. All right, viewing. We have different types of speculums and scopes that would fall in this category. Very similar to retracting, but it's more of a scope to like look deeper inside. The retractor is going to like pull something out of the way to help with seeing. So this would be the Farrier ear speculum. You also have other ear speculums like the Boucheron. Those are pretty common. Nasal speculums, okay. Anoscopes, any hysteroscopes really would fall into that category too. Grasping and holding, these would be like your forceps, or sometimes we call them pickups, or on the street, they probably call them tweezers. Okay, that's what layman term would be, tweezers. We just call them pickups typically. So this one here, it's kind of hard to see the tip, but that is an Adson with teeth forcep. It's a tiny little tooth right there on the tip of that. And then the DeBakey forcep is also very common for grasping more delicate tissue. All right, suctioning. There's a lot of different types of suction tips depending on where or what type of fluid you need to remove. This here at the top is the Fraser suction. Some books will call it a Fraser-Ferguson, kind of the whole word, Fraser-Ferguson. We always called it a Fraser, but it has a little thumb hole here. You can't really see it, but put your thumb over it for a little bit more control in your suctioning in small areas, like the ear. We use it a lot in ears or maybe small vascular cases, neuro. And then Yankauer would be used most often to suction in the mouth or ENT anesthesia, but it can also be used in abdominal cases to suction out larger amounts of blood. All right, suturing categories. So your needle holders, sometimes we call them needle drivers, hold the suture needles so we can close up wounds, tie off things, etc. So this one here is super common. It is the Mayo-Hagar needle holder. Mayo-Hagar. So it is pretty standard. It comes in a variety of lengths, sometimes a little bit of variety of width, but you'll see it in pretty much most trays. And then the Ryder needle holder is much more delicate. It has a more pointed tip that holds smaller needles, maybe in vascular. Dilating, sometimes we have to enlarge a structure to maybe put something else in so we can see what's going on. So for example, this is a Hagar dilator. They come in we call them graduated sizes. So you have a set of smaller to bigger sizes and you lay them out, and either you will pass them or the surgeon sometimes with these will just pick them up off your table and use them. So these Hagar dilators are to dilate the cervix. Maybe we need to dilate the cervix so we can put in a hysteroscope so we can see inside the uterus. All right, then you have Van Buren urethral dilators as well. Dilates the urethra, typically the male urethra. So here are your categories. I'll give you examples of each. All right, when we talk about identifying instruments, you always need to look at the tips of the instruments. Sometimes the handles of these will change based on the company who makes them, but the tip typically stays the same, okay? So if you're trying to identify between these two forceps, and at first glance, they look the same because they're both forceps, but you're gonna train yourself they'll automatically look here first, right at the end where the tissue will be in contact with the instrument. So this one here on the left is a DeBakey forceps. I mentioned that earlier. So DeBakey, pretty fine, but it's kind of got like these longitudinal grooves, I guess you could say, that kind of set them apart from any other forceps. Those are classic DeBakeys. You'll just know, okay? So good for grasping delicate tissue like peritoneum, maybe vascular. I've seen docs use it on bowel. It's pretty atraumatic. So you'll hear that a lot too when we're talking about instruments, whether they're traumatic or atraumatic. If something is atraumatic, it will not damage the tissue. Okay. If something is traumatic, like this one over here on the right, it will damage the tissue because look at the tip here. There's a tiny little tooth right on the end of it. So if I were to clamp or grasp down on, let's say, bowel tissue, which is very delicate, you could poke a hole in that very easily. If I were to clamp down on that, I'm going to poke a hole in the bowel. It's traumatic. I could damage that tissue. It could really hurt the patient by not using the correct instrument. Now, I I know we typically are not the ones that are using these instruments on patients, but surgeons rely on you to hand them the correct thing because sometimes they're not going to look up at you when you pass the instruments and put it in their hand. They're just going to go right to using it. And if they accidentally clamp down on bowel with something that they were expecting to be atraumatic, that could hurt that patient and that could come back on you. So you need to be very careful in identifying these instruments correctly and being confident. The surgeon will know whether or not you're confident and if you know your instruments for sure, okay? So always look at the tips. That will dictate its use. This is obviously going to be used on something delicate, and because of this tooth here, that would be better for grasping something a little more dense, like subcutaneous tissue or fascia. We call this a rat tooth forceps because you know how rats have like a bigger tooth. That's what we call it. But sometimes it's just called a standard tissue forceps as well, or a thumb forceps. Okay. So we can also classify instruments or select instruments based on the type of tissue they need to be used on, like I had mentioned just before. So look at the tips. Would that DeBakey pick up very well on skin? Probably not. I've seen surgeons do it, but sometimes it slips because it's not very grippy, and skin can be pretty dense unless you're like on delicate facial skin or something. So Adson forceps, Adson with teeth, or an Adson brown, there's a couple variations of that, are more often used on skin. So the Adson doesn't really come in any other length. Some do, but this one really doesn't. So it's better just for skin, superficial layer. Adipose tissue is that fatty layer beneath the skin. So that rat tooth forceps is really good for that. So when they're suturing, let's say the surgeon is suturing their layers closed at the end of the case, you need to have those ready. You anticipate what that surgeon will need on each layer as they close it. So if it's an abdominal case, they're going to start closure, maybe the peritoneum with the DeBakey, for example. And then they're going to switch their suture and probably their forceps as they work through the layers. The rat tooth, you're going to have, closer to the top with the adipose tissue. And the last one would be your Adson with teeth probably on the skin. So just kind of keep that in mind, and that lets you anticipate what that surgeon will need. That is the skill that comes with time, but it can be done if you just pick up on those little clues right there, okay? This is a common one, lung and spleen, because these two I put together because they're both very delicate organs. Now, if you're doing big open belly cases, this would be the retractor of choice to delicately retract these organs out of the way. We call it a Harrington sweetheart. It is kind of shaped like a heart on the end, okay? But the lung or even liver, I guess I probably should have put liver here, liver and spleen are very, what we call friable. So even just barely touching it would kind of like dent into it, could really like tear that tissue in a way that would damage it significantly. So those you have to be very careful with. Muscle is a denser type of tissue. So a Russian forceps, or this right here, is a Ferris Smith forceps. It's like a bigger version of that rat tooth forceps I just showed you. It's got a tooth here on the end. The grippy area for the surgeon's thumbs is a little bit wider, so it's got a little bit more traction, you could say, on that particular forceps. And then maybe bone, that's also very dense, but they have their own set of instruments that's very specialized to bone. But for example, the Lane bone holding clamp would only be good on fixing bone fractures. Okay, so that kind of gives us a summary of, the categories, what instruments are made of, and we'll dive a little bit deeper into those specific instruments as we work through our course. But if you have any questions at any point during this quarter, please don't hesitate to reach out. Here's my email, mludwig@herzing.edu. I do have office hours on Tuesdays from 3 to 5, or if that doesn't work, we could work something else out, okay? So get in touch if you need anything, and have a great week.